Hi, everyone. My name is Zachary Gersten, and I am the technical manager for the session, which is chaired by Amakanaji.
Thank you very much, Zach. And I would like to welcome everybody to this session on conflict, crisis, and shocks. My name is Amakanaji from Innovation for Poverty Action Nigeria, and I'll be chairing this session. So for a preamble, fragile countries are especially vulnerable to shocks and climate change, food crisis, disasters, and their spillover effects. And we know that with the pandemic, it's a stark reminder of how sudden crises and interconnected risks amplify challenges in vulnerable countries. In conflict-ridden countries, the impact of shocks tend to be greater and more pronounced. Vulnerabilities, conflict violence, which often obstruct resilience building. Faced with several shocks happening at the same time, affected countries struggle to respond to these, and their vulnerabilities to future shocks increase. The speakers in this session have done amazing work in the area of impact of conflict, crisis, shocks on livelihoods, household livelihoods, welfare, and also the methodological limitations of remote data. And finding from their study aid developmental efforts as well as strengthen research evidence in this space. So I will just, so before we start the presentations, I will reiterate the housekeeping rules. Each speaker will have 8 minutes to make their presentations. I would give a signal at when you have 1 minute remaining. So just to let you know that your time is almost up. And we'll take the question and answers session at the end of all the presentation. So feel free to write, as Zach mentioned, feel free to put down your questions, whatever questions or comments you have in the chat box, and will be addressed during the question and answer session. So we're meant to start with our second presenter, Dr. Hans So, the Deputy Director, Helen Keller International, Myanmar, and he'll be making a presentation on the topic, a multi-sector nutrition and food security initiative in Myanmar, increased access to nutritious foods and improved maternal and child nutrition before and during 2 protracted crises. Over to you, Hans.
Okay, thank you very much. I'm Dr. Kanso. Good evening, afternoon, and morning from the Myanmar. My name is Dr. Kan, and I'm a country representative for Helen Keller International in Myanmar. Today, I am presenting results from the multiple assessment conducted in the multi-sector nutrition and food security program that began in 2017. Helen Keller International, with funding from the Kin Philanthropies, implemented a 5 years multi-sector nutrition, food security, and rural livelihood initiative in 7 townships of 2 regions in Myanmar. That from January 27 to February 2022. The project had been running for 3 years before the COVID-19 pandemic began in early 2020. Myanmar, like many other countries in the world, shut down multiple times for the extended periods and causing extreme disruption to livelihoods. As if the country were not experiencing enough hardship, the military coup of February 2021 kicked off a second crisis of the political conflict and the economic instability. These 2 protracted crises are causing disastrous effect on the food and nutrition security. In association with the Kin Philanthropy Project, Helen Keller conducted the multiple assessments, which gave us an opportunity to not only assess the program impact on the food and nutrition security of the women and children in 1,000 days window, but also to assess the potential protective effect of the program. I just quickly want to highlight the key program interventions that were assessed. These are training on plant and animal-based household food protection, not all household land both agriculture inputs, and the essential nutrition and hygiene action education, and the increased access to the nutrition access. From November 2018 to October 2019, we conducted the quasi experimental study with 950 households. This includes 475 interventions and the 475 control households in one of the 7 townships where the program was implemented. Data were collected 3 times over a period of a year. The study was designed as a randomized control trial, but since we randomized within the program participants, after they were recruited for the program, it is not a true RCT. However, the same criteria were used to select the participants in the purpose of the study is to assess the impact of the program interventions on home garden practices, household food security, and dietary patterns of the women and children. This study occurred before either crisis began. In January 2021, almost a year after COVID-19 pandemic began, we conducted the cross-sectional comparative assessment with 600 respondents. The purpose was to collect information on the COVID-19 related risks and response perceptions and the risk mitigation behavior. We also collected data on the household food protection and the dietary patterns. This study was conducted only with program participants and was a one-time data collection. Note that these data were collected just before the military coup occurred in February. Finally, due to the extreme disruption, such as the rise in the food prices, disrupted supply chain, and loss of income from the both COVID-19 and the pandemic and the military coup, we conducted a food security assessment in August 2021, 7 months after the COVID situation assessment, to gain a better understanding of the impact on the program household. For this assessment, data were collected from the 378 respondents via phone. This is a one-time data collection with the program participant and was not an experimental design. Only result related to the household food protection and the consumption, dietary patterns, and the household food security are being presented today from three assessments. A result from the quasi-experimental study collected before the COVID-19 pandemic hit found that over the 3 rounds of the data collection, the program positively impacted women's dietary diversity, children's consumption of the nutritious food, and the household food security for the participants' household compared to the control household. Though not significant, minimum adequate diet for the children 6 to 23 months, 24 to 59 months were better for the program participant. The household food protection data did not show a significant change in either intervention or the control group. However, a larger proportion of the intervention household produced food in the garden and had more varieties in their gardens than in control group. In January 2021, 10 months into the pandemic, 41% of those surveyed reported problems getting enough food for their household. 7 months later, in August 2021, following 6 months of the political instability, 49% of those surveyed reported having difficulty meeting their household food needs. This is an average increase of 1 percentage point. Result found the gardens are the critical source of food, and the consumption became more frequent during the dual crisis. Almost 1 year after Myanmar started experiencing pandemic lockdowns and the disruption livelihood, 75% of the cane essential households still had an active home garden. 83% of those families ate from the garden 3 to 7 times per week. 7 months later, the proportion of the household with an active garden had decreased to 62% and 71% ate from the garden 3 to 4 times per week. Note, this is still significantly higher than 35% of households with a garden at baseline. Families report decreasing access to income, markets, and the productive resources as reason for the decrease in the garden protection. However, each family's situation is unique. Some families said they increased consumption of the food produced at home because of less access to foods from the other sources, and the others said they saw more of their produce increase their consumption because they need. In August 2021, the Food Security Assessment found that a man program participant household, after 17 months of the pandemic and then 6 months of the political instability, children 6 months to 5 years of age living in a household with a garden had significantly higher vegetable consumption than children in household without a garden. Women in household with a garden.
You have a minute remaining.
Okay, sorry. This is the last, I lost it. The findings from the January and August 2021 assessment indicated a rapidly evolving food crisis in the data and the central dry zone of the Myanmar. However, the combined result demonstrate Helen Keller's flagship nutrition-sensitive approach to nutrition livelihoods successfully improved nutrition outcomes for mothers and children and household food security in intervention household. Programs need to continue building capacity of the communities to produce food locally through low-cost, climate-smart methods, and also increase efforts to localize food system to increase access to food. Yes, it's finished. Once supply chains are cut off and the family lost access to employment and incomes. Thank you.
Thank you very much for that presentation.
Yes.
I'm really sorry. At some point, I think the audio went off for some reason. Sorry about that. But thank you very much, Kant, for that presentation. So just to remind the audience, if you have any questions, you can put it in the chat box and we'll get to it during the question and answer session. So moving on, our next presenter is Dr. Abigail Conrad, and Elise Reynolds from USAID Advancing Nutrition and Results for Development. They'll be making a presentation on the topic, Agriculture Interventions in Protracted Humanitarian Crisis, how they influence directed diversity for women and children, and the mediating role of social support. Over to you, Abigail.
Okay, great. Thanks. Yeah, so I'm Abigail Conrad. I'm a learning and research advisor in USAID Advancing Nutrition. And today I'll be presenting with my colleague, Elise Reynolds, a PhD student at the Institute for Global Nutrition at the University of California, Davis. And we'll be presenting results on this study on agricultural interventions in protracted humanitarian crises. So while there's evidence that nutrition-sensitive agricultural interventions can improve dietary diversity in development contexts, there's little evidence about their effectiveness in protracted humanitarian or emergency contexts. So USAID engaged us to explore when nutrition-sensitive agricultural activities are appropriate in these contexts and how they can be designed to improve nutrition outcomes. We had 4 main research questions. The first was on the prevalence of adequate dietary diversity for women of reproductive age and children 6 to 23 months. And the other questions cover the association between dietary diversity and participation in agricultural activities, household and other factors, and maternal social support. We worked with 2 USAID-funded agricultural projects in protracted humanitarian contexts. One was a project in the far north of Cameroon implemented by Première Urgence Internationale, and the other was a large-scale nationwide project implemented by FAO in South Sudan. Both projects provided seeds, agricultural tools, agricultural training, and developed demonstration plots. And the one in South Sudan also provided fishing equipment. And first, I'll present the results from Cameroon. This was a mixed method study. We analyzed the project's end-line cross-sectional household survey data, and we did qualitative data collection with 24 households in the survey sample. The main outcomes that we looked at were minimum dietary diversity for women and children. And the survey sample was small. We analyzed a subset of data on 84 women and 40 children who we had complete data for. We found that 74% of women and 53% of children had minimum dietary diversity at the time of the survey at the end line, which was at the beginning of the lean season. We used the quantity of seeds planted as a measure of the use of project support because it was the only variation in project participation that we had in the data set. We were only able to analyze the end line data, and there was no comparison group, and all households participated in training. In this analysis, we found that a higher portion of women had minimum dietary diversity when their households planted more than half of the seeds that they received. When looking at prevalence ratios, there was a positive association between planting more than half of seeds and minimum dietary diversity for women. However, the statistical significance did not remain after controlling for confounding household factors. For children, there was no difference between the portion of children with minimum dietary diversity when their household did or did not plant more than half of seeds received. And we see a negative association between planting more than half of the seeds and dietary diversity. However, we think this should be interpreted cautiously. We're relying on a very small sample size, and all of the households received support. The association also moves closer to the null after adjustment. And the division we used of planting more than half of seeds was a bit of an arbitrary cutoff, and we were limited to that division in the available data. In the qualitative interviews, most respondents reported that they adopted new agricultural practices as a result of the project, and they reported multiple benefits, one of which was increased yields. And this helped them access more food for consumption, and in some cases sale as well, and they used the additional agricultural income to purchase other foods. Taken together with the qualitative and quantitative data, we think that the results indicate there was a positive association between the quantity of seeds planted and dietary diversity for women. We also examined other factors associated with dietary diversity. For women, we found that larger household size was associated with having minimum dietary diversity. For children, being older, having their mother be in a monogamous marriage, and a higher number of household shocks was associated with minimum dietary diversity, although the reason for the latter is unclear. In interviews, respondents discussed the fact that all household members were negatively affected by food insecurity, but adults first reduced their consumption before children would have to. And food preferences and perceptions of what are good foods for women and children also influence dietary choices within the food access constraints that they faced. So looking at social support, overall, women had low social support using the measure that we used. Looking at the association between maternal social support and dietary diversity, we found a positive association between the prevalence of minimum dietary diversity and maternal social support. In interviews, women discussed mostly receiving support from their husbands, and those with social support scores that were above average for the sample more commonly described family meals as joyful, and they described less tension and stress with their husbands. Maternal social support may be positively associated with minimum dietary diversity, since there's a positive trend, but that was not statistically significant. Overall, our findings suggest that maternal social support had a positive association with minimum dietary diversity for women, and could have a positive association for children. Now I'll pass it to Elise to talk about South Sudan.
Great, thanks. We conducted a secondary data analysis of results from the Food Security and Nutrition Monitoring System survey in South Sudan, which was implemented in September through January in 2021. And again, our primary outcomes of interest were minimum dietary diversity for women and children. And our survey yielded a random sample of over 14,000 rural households that was representative at the county level. And more than half of our households were found to be female-headed. We found the prevalence of meeting minimum dietary diversity among the sample was low overall, with only 30% of women and 23% of children consuming at least 5 food groups in the previous day. Participation in any of the previously described agricultural activities was positively associated with meeting minimum dietary diversity for women. Prevalence was 9% higher among women in households that participated compared to those in households that did not participate. However, participation was not associated with meeting minimum dietary diversity for children when the analysis was adjusted for relevant household characteristics. A higher number of household assets, the proportion of food that came from own production, have a member part of a social group, and a higher household dietary diversity score were all positively associated with meeting minimum dietary diversity for both women and children. Social support was also examined in South Sudan, but no significant associations were found, and overall average social support scores among women were low. In conclusion, we find that agricultural interventions have the potential to improve dietary diversity for women as part of nutrition-sensitive programming in food insecure, protracted humanitarian crisis contexts. Agricultural interventions can increase dietary diversity through both food production for consumption and income generation pathways. Support for complementary feeding should be considered as an intervention to increase the percent of children meeting minimum dietary diversity. In both studies, several households and external factors were associated with meeting minimum dietary diversity, but many varied by women and children and varied by context. However, in both South Sudan and Cameroon, we did not find household food insecurity status to be associated with dietary diversity for women or children. Finally, the influence of social support on dietary diversity requires more research, but results from Cameroon suggest maternal social support may be an important consideration in project design. Thank you.
Thank you very much, Elise and Abigail, for that really, really interesting presentation. So without much ado, we'll go to the next presenter. Our next presenter is Olusegun Fadare, a doctoral scholar at the School of Agricultural Policy and Development, University of Reading, and he'll be making his presentation on the role of livestock assets and conflict exposure in the development of mental illness symptoms among Nigerian farmers. Over to you, Segun.
So thank you for the introduction. So I'll just go straight to my presentation. And I will be speaking on the role of livestock assets and conflict exposure in the development of depressive symptoms among Nigerian farmers. So in the 21st century conflict in Africa, farmers as producers of food are disproportionately vulnerable as attack on food system is a weapon, seen as weapon used by conflict actor. And for example, in Nigeria, terrorism and farmer-aider conflicts disproportionately affect the farming communities. And in general population, conflict leaves 1 in 5 people with 1 or more symptoms of mental disorders, such as depression, anxiety, and post-traumatic stress disorder. While in farming population, the losing livestock and the concern associated with losing livestock can trigger depression, and also can be a channel through which conflict effects on depression can be reinforced. So our objective is to examine the effect of conflicts on the risk of depression among farmers in Nigeria and the moderating effect of livestock assets, cattle, sheep and goat, and poultry. So this is the Nigerian map showing the distribution of conflict events across the local government from 2009 to 2019, and then the trend over the years. So this conceptual framework of the link between conflict, livestock assets, and depression is inspired by the study by Correns and Wills and Van den Busch and Meyer Lindenberg. And conflict exposure is a stressful event, and for it to induce depression on farmers that has livestock assets, it has to go through a biological pathway called chronic stress. And chronic stress is induced when an individual appraises a situation as threatening and or is demanding and has no control over it. So for a farmer that has livestock and, for example, cattle, that is the store of wealth for an average household, in conflict situation, the farmer will go through this appraisal process to examine how vulnerable these assets are. And we know that cattle is very vulnerable in conflict situation. So can lead to, I mean, it's increased. There is high chance of being lost, or the probability of being lost is high. So it can lead to chronic stress, unlike other livestock assets like poultry and sheep and goats. So this informed our hypothesis that we stated as conflicts and cattle has positive relationship with depression, while poultry and sheep and goat has negative relationship with depression. So we used two data sets, one from the Living Standard Measurement Study, Integrated Survey on Agriculture, then with the armed conflict location and event data sets to locate household in a conflict situation. The data set is nationally representative, and it captures 5,000 households, of which 65% are agricultural households. And in the 2016 survey round, which collected information on the mental health of household head, which we identify as keepers of livestock or owners of land, field, cropland. So we use the mental health survey, the mental health questionnaire administered to these farmers, which adopted Center for the Epidemiology Study Depression Scale to compute the CESD score for farmers, and then which is our dependent variable. Then we got the dummy variable of the score to categorize farmers in probable depression and those not in probable depression by cutting it from 8 score and above. Then our conflict exposure, which is a objective measure of conflict, then conflict experienced by household, which is a subjective measure of conflict. Then we have our livestock assets measured by tropical livestock unit. Then this is the descriptive results. It shows that 2 in 5 farmers in Nigeria are at risk of depression, and those that are at risk of depression are more exposed to conflicts, or as experienced conflicts, or as sheep and goat and cattle. And those that experience conflict or are exposed to conflict are more at risk of conflict, as you've seen as shown by the red graph, leaning towards forward. So these are the 10 questions administered to farmers to know the depressive symptoms they've undergone through in the past 7 days. And these are the response, the proportion of farmer that answer yes to the question. And these are the signs of the effect of conflict and livestock assets on each of the depressive symptoms. And we can see that conflict has positive relationship with being disturbed and being troubled and also being afraid. And poultry has negative relationship with 7 of these symptoms, while goats, sheep and goat has positive relationship with unhappy and lonely, with cattle having positive relationship with also similar symptoms that exposure to conflict has, disturbed and troubled. And this is the result of the joint effect of conflict and livestock assets.
1 minute remaining.
Okay, and just to make sense of the results, we've plotted the predicted probability of these results, which shows the probability of household that are of farmers that are exposed to conflict is about 45%, and it decreased for poultry to almost about 2.5%, and increased for cattle and sheep and goat to almost about 70%. And in conclusion, conflict exposure is a strong predictor of farmer exhibiting depression symptoms. And just to go to the implications, and good mental health for farmers is imperative in the fight against hunger, food insecurity, and malnutrition. As also there is a need to extend psychosocial support to farmers to mitigate the effect of conflict on their mental health. And beyond income and food consumption, poultry production may have psychosocial benefits for farmers, and our finding also inform humanitarian intervention on livestock species that may be used as relief in conflict situation. For example, cattle may be more of stressor rather than a succor in conflict situations. So it's not a good idea to use cattle.
You need to round up.
Thank you very much.
Thank you very much. So we'll move to our next presenter. Our next presenter is Professor Nilupa Gunaratna, an associate professor of the Department of Public Health, Purdue University. And she'll be making a presentation on the topic, methodological limitations of pandemic data collection. Where do we go from here? Over to you, Nilupa.
Thank you very much for that. I'm very excited to join everyone today, share this work, which was done together with my colleagues, Madeline Powers, Morgan Bonsick, and Ramya Ambikapathy, all from Purdue University in the United States. So we know that crises and shocks can worsen food security and diets and can exacerbate nutrition inequities. And when such shocks occur, there's always this desire to have data quickly to inform actions. So the COVID-19 pandemic spurred many studies, and they were given the urgent need of data coupled with the concern about infection. Many people used new methods for both sampling and data collection. So in this study, we're looking at some of the methods that are used to assess their strengths and limitations. So specifically, we're examining studies of COVID-19 and food security throughout the world with special attention to sampling, data collection methods, and analysis and reporting of outcomes. We conducted a Google Scholar search for studies on COVID-19 and food security published between the start of the pandemic and July 2021. We chose Google Scholar to capture both peer-reviewed and gray literature. Studies were excluded if they didn't report outcomes related to diets, food security, or food systems, or if they did not provide at least an abstract or summary in English, or if they were just inaccessible. For each study, data were extracted on geographic locations and populations covered, data collection timing and methods, reported outcomes, and disaggregation of results. So in total, we found 216 studies in 92 countries. The United States was the most represented with 62 studies, followed by Bangladesh with 18 studies. However, most countries, if they were represented, had 1 to 2 studies. Importantly, only 8% of studies were conducted in a low-income country. This means that many of the populations most vulnerable to the pandemic's effects were excluded in this post-pandemic research. Here is a summary of sampling methods used by each study. Only a quarter of studies used random sampling, which would yield a representative sample. Other studies used non-representative sampling of various forms, and a good 29% did not provide enough information for us to determine whether or not their samples were representative of a larger population. Representative samples are important because they allow findings to be generalized, right? So that gives us information that can inform action without bias or without excluding potentially vulnerable groups. So even if you have representative sampling, you can still introduce that bias and limit your generalizability depending on your data collection methods. So this is a summary of data collection methods that were used. Most studies collected data remotely, using phone or the internet. This included social media. Again, some studies were unclear in their methods, and only 15% reported response rates. So the pandemic also, and the measures taken to respond to the pandemic have changed sometimes rapidly over time. However, most of these studies were cross-sectional, and only about 1 in 6 reported more than one time point of data collection. Here's a summary of outcomes across these various studies. So we specifically searched for studies on food security, so naturally we see that in the majority. Other common outcomes included income and expenditures, food availability and access, and then to some limited degree, diets, coping strategies, and mental health. 30% of studies included respondents who were actors within food supply chain. This slide and the next one will show characteristics by which reported outcomes were disaggregated. So overall, 69% of studies reported disaggregated outcomes. However, only 19% reported outcomes by gender, 17% by income, 16% by race and ethnicity. And that even though research has shown that experiences can really vary greatly within countries, only 15% of studies disaggregated results subnationally, and 8% distinguished between urban and rural locations. Here's a continuation of the same table. Note the scale is different here because these are less frequent characteristics to disaggregate by. This graph here shows when data collection began for each study and when the findings were published. So you can see data collection peaked in the second quarter of 2020, and then it declined, but publications have been steadily increasing. This suggests that much of the published work is capturing only that first wave of the pandemic with limited data collection thereafter. So just to conclude this part of the talk, the COVID-19 pandemic really accelerated trends that were occurring before the pandemic, especially towards remote data collection. Both sampling and data collection methods lead to non-representative samples, and these have some significant limitations. So they can exclude the most vulnerable, they can lead to biased estimates, and they can limit generalizability when we want data to inform our decision-making. And further, when we don't disaggregate findings, we're not able to identify important inequities. So I know these concepts may sound a little bit abstract, so I just want to show an example using simulation. So here we have an example where there is representative data on some outcome of interest, and it's disaggregated by the respondent's gender. So every dot here represents one person. So we can calculate the average out for each outcome for men and for women, and then the difference between those two is the gender disparity. Now, here's the same graph, but some dots are missing. So in this simulation, people with lower levels of the outcome are less likely to be sampled. So for example, if you're studying income, low-income individuals may be more likely to be missed. And because women in this example have lower incomes in general, they're more likely than men to be missed in the sampling. So if you look at this and calculate means or averages, what you see is that the averages are higher and the gender disparity that's estimated is lower. So these are all examples of biased estimates that come out of bias from the sampling method. So here's another extension where we've added some further bias due to data collection method, where women with very low
Minutes remaining.
Sure thing. Are even more likely to be sampled. So for example, if data are collected by mobile phone and a household has only one phone, that phone is more likely to be in a male household member's hands. And so what you see with that scenario, again, is that the means are increased, biased upward, while the estimate of the disparity is biased downward. Okay, so before I conclude, I just want to very quickly raise some ethical issues that may arise in this kind of work. We know that this work is very important, but it's also important to follow standard practices, such as having IRB consent, IRB and informed consent, which protects the needs of respondents. Some of these newer methods, especially remote data collection, raises additional concerns around privacy and data ownership. Online surveys, for example, collect metadata that can easily identify participants, even when a survey is anonymous. And then finally, and we can discuss this further, but there can be implications for research practice as well, both in how we engage with communities and whether we create research inequities in practice. So in all likelihood, the methodological shifts that we've been seeing during the pandemic are likely to continue, and future shocks and crises will as well. So rapid data collection is always going to be critical. So the question then is the issue around compromising methodological rigor, because that does have costs.
Need to round up, sorry.
Okay, sure thing. So here's some initial ideas of what we can do, both as researchers and through scientific journals, in order to increase transparency and to promote equity as well. So thank you very much.
Thank you very much. So move on to our last presentation for the day. The presentation is from Dr. Mercy Mwambi.
Hello, everyone. Thank you for joining my presentation today. My name is Mercy Mwambi, and I am a postdoctoral scientist for impact evaluation at the World Vegetable Center based in Bangkok, Thailand. Today, I'm going to speak about the effect of COVID-19 on the affordability of a healthy diet for urban populations in Thailand and the Philippines. I will take you through the introduction, and then we look at the methods and later the results and discussions. We understand that humans need different types of food for them to be healthy. The intake of fruit and vegetables is of a particular concern since these are relatively expensive and were widely underconsumed even before the pandemic. When we look at vegetables, for instance, the regional average for Southeast Asia is just above 200 grams per person per day, against the global recommendation of 300 grams. In Philippines, in particular, the average consumption of vegetables per person per day is around 110 to 130 grams, which is still fairly low. COVID-19 is expected to have affected the urban populations for several reasons. This is because first, the COVID-19 has impacted on food systems. The disruption of food systems from the supply side, where there is now reduced farm production, disruption of markets and trade, and on the demand side, where there is reduced market demand as people lose income and jobs. And the second reason is because the urban population depend on purchased food and work in sectors affected by the pandemic. Our study builds on the existing evidence of COVID-19 and healthy diets by assessing the effect of COVID-19 on affordability of a healthy diet among the urban population in Bangkok, Thailand, and Manila, Philippines. To do so, we asked 3 questions. And the first one is, how does food expenditure compare to the cost of recommended diet? And then what is the impact of COVID-19 pandemic on the cost of recommended diet? And how has COVID-19 pandemic affected the affordability of the recommended diet? We used a combination of different methods to answer these research questions. To estimate the cost of recommended diet, we followed Raghunathan's method, in which we select the 2 cheapest items in each food group and sum the cost of these cheapest items per food group to get the cost of recommended diet. To measure impacts of COVID-19 on the cost of recommended diet, we use the regression discontinuity design. And to measure affordability, we assessed that using per capita spending on food and creating scenarios to assess the impact of during COVID-19. So in this case, we assumed contractions of food expenditure of 10, 15, and 20% following COVID-19 lockdown. And then apart from the contraction of food expenditure, we also consider the effect of government relief funds, which were provided to urban populations in its two different countries. The data we obtained from the National Statistics Offices, both the price data as well as the household income and expenditure data. So for our key results, we find that the effect of COVID-19 on price of food in 2020 varied across food groups and countries. For instance, in Bangkok, the effect of COVID-19 led to a reduction in the price of fruits by 0.06 US dollars, or a 33.3% reduction, and also a reduction on the overall cost of recommended diet by $0.02, which is approximately 3% compared to the pre-COVID price. In Manila, the impact of COVID-19 on different food groups, we find that the COVID-19 lockdowns restrictions led to an increase in price of fruits, as well as an increase in price of vegetables by 0.02 US dollars. The price of eggs also increased. So we find that the price affected the nutritious foods, like fruits and vegetables, and also protein foods, especially in the case of Manila, where the prices increased. The small but consistent increase in the price of vegetables is a threat to the already low consumption that existed before COVID-19, where the per capita spending on this food group was 64% less than the cost required to meet the minimum recommended diet in 2019. So then how does food expenditure compare to the cost of recommended diet? Using the data of 2019, we estimated this, and we see differences across food groups and across countries as well. If we look at the minimum cost of meeting the recommended diet, we find that it is high compared to the food expenditure in the case of Manila. So Manila people need to spend at least 30% more to meet the minimum cost of recommended diet. But in the case of Bangkok, the population here is spending more than the minimum cost of recommended diet, and the spending is 82% more. When we look at spending per food group, Bangkok people are spending on average much more on nutritious foods, such as protein foods. They spend at least 538% more. On vegetables, they spend 203% more, while on fruit, they spend 193% more. When we look at Manila, we find that spending is less, for instance, in terms of vegetables, where they meet only 36% of the required cost of recommended diet. Same applies also for fruit. The Manila population is only able to meet 35% of the cost. The next research question was aimed at assessing the effect of COVID-19 on affordability of a healthy diet. And to point out here is that before the pandemic, people in Manila were already in a worse state in terms of affordability, with 5.4 million people not able to afford a healthy diet. In Bangkok, the situation was not bad because we see almost everyone was able to afford the cost of a healthy diet. If we assume contractions of 10%, 15, and 20 for food expenditure, the situation worsened in Manila. We see an increase in the number of people not able to afford a healthy diet by about 2 million in the case of 20% contraction, and about 1.3 million in the case of 15% contraction. Same applies for Bangkok. Without government relief, we find that if there is 15% and 20% contraction in food expenditure, then at least 1.3 to 2.27 million people are not able to afford a healthy diet. However, our results show a promising effect of the government relief fund, where we find that with this relief fund, the urban population in Manila as well as Bangkok was more people were able to afford a healthy diet, and therefore we find that these government relief funds were able to mitigate the negative impacts of COVID-19 as relates to affordability of a healthy diet. So yeah, just to point out that in any situation, of course, the urban vulnerable, the poor people are the ones that are likely to be most vulnerable to unaffordability and loss of income and loss of jobs. So we expect that the poorest of the poor are affected in these two contexts. This paper is written by me together with Pepin, Suwana, and Jody Harris. And we would like to thank our funders, the Ministry of Foreign Affairs in Taiwan, and our partners, that is Kasetsat University, for contributing to this work. Thank you very much.
Okay, perfect. So this rounds up all the presentations for this session. And I want to thank all our presenters, for their very, very interesting and important work that has been presented here today. So now we'll go to our question and answer session. So in the chat box, we have a question by Claire for Abigail and Ellis. And the question is, what were the agricultural interventions involved? Were they similar to the two countries, and were there multiple interventions?
Yeah, so the interventions were a bit similar, and there were multiple. In both cases, they provided seeds, so grain, legume, and vegetable seeds to households, and they provided agricultural production training, some just basic group training, and then they used a trainer of trainers approach. So they identified farmers in the communities and provided them with more farmers, trained others in their communities, and helped to manage demonstration plots. And in South Sudan, they also provided fishing equipment to fishing households.
There's another question here from Ramia, and it says the minimum directed diversity for women is about 74% high before lean season. And she says, can you comment about the context for this relatively high MDDW, especially in the humanitarian context?
Yeah, so those rates were high, particularly during the lean season, and it was a lean season that was projected to have crisis levels of food insecurity in that region. It may be because of the project. All of the households in the survey received support from the project, so that may be part of it. And I see a question in the chat too, whether there was any nutrition education included. In Cameroon, there was very little. In South Sudan, it was more consistently included in the training, but it wasn't a focus in either case. And it was a recommendation from the implementers that we talked to increase the amount of nutrition education.
Thank you very much, Abigail. So the next question is for Olusegun Fadare from Claire. And the question is, what did you include in your classification of conflict? Did this include all ACLED entries or just violence against civilians, for example? Have you looked into the impact of different types of conflict?
Thank you for that question and for the interest you have in the study. So I included all the armed conflict events in the ACLED data sets, all violence conflict, excluding non-violence conflicts. So, but predominantly, we have two main predominant conflict situations in Nigeria, the terrorism from Boko Haram and the Farmer-Eda conflicts. So those are the core ones within the period covered. But it captures all the type of conflicts. The other subjective measure that I use is the reported conflict experienced by the household themselves. So I use the two together just to test the robustness of using the exposure to conflicts.
So there's a follow-up question there on whether you examine how gender mediates some of the effects on mental health. So I guess the question basically is if you carried out a gender disaggregated analysis.
Yeah, the questionnaire was administered to the head of household, which they are mainly male. So I didn't do any gender disaggregation.
I have a question for Shegun. You mentioned that the effect of owning poultry on conflict had a kind of buffering effect, right? And I want to ask, what do you think is the reason for this buffering effect of owning poultry on conflict exposure as compared to owning sheep, goats, and cattle?
So poultry, of course, from the conceptual framework, we understand that poultry and sheep and goats, they are less vulnerable to attack during conflicts. And that is one, unlike cattle, that they are the major targets if they can be targeted during conflict between farmers and herders, or targeted ferociously by terrorism or any situation of insecurity. But for poultry, two pathways I can say. One is studies have shown that they may have therapeutic effects on the keepers. That is one. And then studies have also shown that eating poultry meat, like white meat, as a way of reducing reducing the risk of depression. So, but more studies are needed to substantiate all this and validate some of these findings. Yeah.
Thank you very much, Ego, for that response. So in the chat box now, I can see a question from Savannah for Jody. She says, if I understood correctly, people are spending more than they need to on protein foods to meet their needs. If so, is that because the cheapest type of protein used in the CORD calculation is not preferred food?
Thank you, Savannah. That's a great question. And yes, I think you have understood correctly. So this was only in Bangkok, so only in Thailand, that people were spending more than essentially they needed to on foods. In Manila, this was not seen. People needed to spend more on food to get to a healthy diet. But in Bangkok, yes, people were essentially spending more than the minimum that was required. And on the protein foods, because the cost of a recommended diet method requires that you get the prices for all of the foods in different food group categories, and then you pick the lowest cost. I think that's probably a sensible conclusion to come to, that I think it was something like chicken carcass or something was the cheapest protein food category. And of course, yes, that's not necessarily the food that people are choosing to eat. And so I think that probably is the explanation. It is a limitation that's been recognized of the cost of a recommended diet method, and some people have extended that method by including food preferences or cultural preferences as well as cost. So we didn't in this case, but it is an option, and it would be interesting to see how that changed the calculation. So yeah, great question. Thank you.
Thank you very much, Jody, for that response. I have a follow-up question. So I want to ask if there's a possibility of carrying out some kind of sensitivity analysis for marginalized households, for example, female-headed households or minority households, especially in Bangkok, and their ability to meet their cost of recommended diet post-COVID.
Yeah, another great question. So we always try and focus on equity and marginalization in our work. In this study, so this was the second part of a three-part study. The first part of the study was looking at how policy had changed during COVID. The second part was this one, how the economy and economics of food had changed. And the third one is how social aspects of food and people's experience of their food environment had changed during COVID, all in those two countries. So for this one, we used already available data. And that data is not always disaggregated by the things you say, by female-headed household or by other aspects of equity. And that's something that broadly in all of our work and in work in other places we're pushing for, right, is one of the very bare minimum things we can do to understand inequity in food systems is to disaggregate data like that. So in this case, I don't think it was, but in the third part of the study, the experiences of food environments, we explicitly went and searched for those households. We went to slums, we went to people who lived along the railway tracks, people who lived along the streets, and we asked about their experiences of affordability and their experiences of food environments. So although we couldn't do it explicitly in the economic assessment because the data weren't there, we then followed up with qualitative work to look at those experiences. So yeah, really important point. Thank you.
Thank you very much, Eddie. So there's a question in the chat for Nilupa from Claire, and it says, could you comment on the recommendations you would make to researchers using the existing bias data? Is reporting the biases enough?
Sure, that's a really good point. I think it's necessary. In ideal world, it's not sufficient, right? So I think it's important as we use new methods to kind of just assess how they're influencing our estimates and who we're excluding through the different mechanisms we're using to find participants and find our data and to actually collect it. So I think that analysis is important, but when we do present our results, those are often discussion section type things and can easily be overlooked. So I think there's an onus on us as we develop these new methods to develop methods that can be better over time as we go to develop more representative methods to deal with some of these great new technologies that we have for data collection to work remotely. There are definitely so many benefits there. It's not just a risk of infection, it's lower costs and other kinds of benefits that are important, I think. Thank you.
Thank you very much, Nilufer, for that response. If there's no question, I have a question for Kant. So my question is, could the mother's dietary diversity be a mediating factor influencing the impact of home gardening on children's dietary diversity and food security through the two crises?
So yes, the mother's dietary diversity, what we found was that it was associated with higher children's dietary diversity. So having an active home garden was associated with higher dietary diversity for both women and children, and higher consumption of nutritious foods like vitamin A rich foods and iron rich foods. What we did find is that women, the farther along the crisis went, both crises, that women's dietary diversity began to decrease. And we felt that, which is what we see in disasters and other crises, but that as a coping strategy, often women in the family will reduce quantity or quality of diet. And so we did start to see that effect as well.
Thank you very much, Meredith. So I have a question for Abigail and Ace. So your respondent, though, I would like to know if you kind of like differentiated between the refugees and, say, vulnerable households in host communities, because I think this would have implications for the results and for understanding the different contexts.
Yeah, good question. In Cameroon, there were only a small portion of households were refugees or IDPs. So in the quantitative analysis, we didn't do that disaggregation, but in the qualitative, the access to land was the primary constraint that was discussed for refugees. And I'll let Elise comment on South Sudan.
Yeah, we also examined it for South Sudan, and we found that regardless of resident status, about the same percentage of households received the intervention. And then we also didn't see any association with resident status and dietary diversity for women or children.
Thank you very much for your responses. So in the absence of any other questions, I want to thank all the speakers. I also want to thank the audience for listening to the end and engaging with the speakers. Have a lovely rest of the day, and I hope to see you at other sessions.
And thank you too so much for sharing this session. We had a great experience.